Hello everyone, Dr. Tom Chaney here from Living Health Integrative Medicine in Annapolis, back with another video. In today's video, I'm going to discuss Alzheimer's disease and I'm going to discuss type 3 diabetes. And specifically this research paper that came out recently and talked about, can Alzheimer's disease be a form of type 3 diabetes? And as you may recall from one of my previous videos, I talked about the three key components of a healthy brain. And one of those components is glucose and blood sugar. The brain definitely needs blood sugar, but it needs it in the right amounts. Too high or too low will damage and kill brain cells, and that's what they showed, and that's what they discussed in this research paper. They talked about metabolic syndrome and type 2 diabetes represents an independent risk factor for Alzheimer's and pre-Alzheimer's. So if you're a diabetic, if you're a pre-diabetic, then that is something you want to definitely use as motivation to reduce your risk of Alzheimer's dementia. We see both of these diseases are increasing in epidemic proportions. One of the other topics that they discuss is they say new knowledge in the area of molecular biology and epigenetics will probably help to make an early molecular diagnosis of dementia. Well, what we have available to us now for many of our cognitive decline patients is we have the ability to do imaging studies, and we can look at volume of the brain, and we can detect changes in brain volume 40 years prior to ever getting a diagnosis of Alzheimer's. So you can see these changes in the brain before you ever have any type of subjective changes. So before you ever notice it or anyone else starts to notice it. This is particularly important for those of you out there that have a family history of Alzheimer's and dementia. This is something that we can run, and then we can take action and be proactive so that you don't have to go down that path of having this disease. So I hope you got some great information from this video, guys. If you have any questions, go ahead and put them down below. I welcome any questions. I'll be happy to do any videos on any of the questions that you may have, and I look forward to seeing you in the next video.